Good afternoon. I'm Mandy Cohen, Secretary of the Department of Health and Human Services, and I'm joined by the Director of Emergency Management, Mike Sprayberry. Karen Magoon and Monica McGee are our American Sign Language interpreters, and working behind the scenes are our Spanish language interpreters, Jackie and Jasmine Matevier. I'll start with a rundown of the numbers. As of this morning, there are 15,816 laboratory-confirmed cases in 99 counties in North Carolina. 521 people are currently hospitalized, and sadly, there have now been 597 deaths. As we begin to ease restrictions, we need to stay vigilant to ensure that our healthcare system can be ready if we see an increase in patients with serious illness from COVID-19. Yesterday, Governor Cooper issued an executive order that allows for compliance with federal directives and creates additional regulatory flexibility to help ensure that our healthcare system, our local health departments, and our counties continue to have the capacity needed to respond to this pandemic. I'm also pleased to announce that starting today, families impacted by school closings due to COVID-19 are beginning to receive additional food benefits. With school buildings being closed, we needed to make sure that the children who get most of their meals at school have enough to eat. The new program starting today provides families who utilize the free and reduced lunch programs at school with extra help buying groceries and putting food on the table. Families will receive about $370 in benefits per child, provided over 2 installments. The great news is that families don't need to apply for the program at all. Beginning today, most eligible families already receiving food and nutrition service benefits will receive additional funds on their existing EBT card. The P-EBT eligible families, the new families not already enrolled in a food and nutrition program, will be mailed a new card in mid to late May. So please remember, as we continue into phase one of easing restrictions, staying home is still the best way to continue to slow the spread of the virus and protect our families and neighbors. If you do go out, remember the 3 W's: wear, wait, wash. Wear a cloth face covering, wait 6 feet apart, and wash your hands often or use hand sanitizer. With that, I'll turn it over to Director Mike Sprayberry for some remarks.
Thank you, Madam Secretary. Good afternoon. Today is day 65 of the state's Emergency Operations Center's COVID-19 response. As we continue working to obtain personal protective equipment for the COVID-19 response, teams delivered to 34 counties and 4 healthcare preparedness coalitions yesterday. Shipments included procedure masks, gloves, face shields, coveralls, thermometers, safety glasses, and hand sanitizer. Sourcing and procurement of PPE, especially gowns, remains a major priority for the state emergency response team. We're working with our partners at the DHHS Office of Emergency Medical Services to plan distribution of personal protective equipment to more than 3,800 long-term care homes across the state. Staff from these adult care homes, nursing homes, and other care facilities will be able to visit local distribution locations and pick up a 2-week supply of PPE, including face shields, procedure masks, gloves, and shoe covers, along with a guidance document on proper use to prevent outbreaks before they happen and details on requesting more PPE when it's needed. We're finalizing those plans now and will begin that distribution later this week. It's good work. Our United partners at NC 211 continue to take calls daily, helping people meet needs related to COVID-19. The United Way at 211 have now answered more than 41,000 calls for assistance and remain ready to serve those who need help with food, rent, utilities, or other basic needs. Just call 211 for their help. And the state's foods banks, thanks to you, are still doing great work supporting people who need groceries each week. You can support the food banks by going to feedingthecarolinas.org and making a donation. The North Carolina National Guard is supporting the food banks with soldiers, airmen, and vehicles that have transported more than 2 million pounds of food and distributed more than 970,000 meals. That's great work by our North Carolina National Guard team, the Always Ready, Ready team. Remember your 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. Follow Secretary Cohen's guidance. As always, don't forget to look out for your family, friends, and neighbors, and call your loved ones daily. Guaranteed they'll love it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you very much, and I'll turn it back over to Madam Secretary for questions and answers.
Terrific. Thank you, Director Sprayberry, and we'll turn over to your questions.
Our first question today is from Brett Baldock with Fox 46 in Charlotte.
Hi, Dr. Cohen. There was a report released by NBC News from the White House that shows Charlotte and North Carolina as a whole are on locations to watch because of the large week-to-week increase in COVID-19 cases. And I know there is a lot more testing being done, and that may be due to the increase that they're seeing. But is North Carolina concerned about being on this list at all, and have they had any discussions with the White House about this list?
Thanks so much for that question. And we are continuing to watch our trends very closely. We have that on our dashboard every single day. We look at a number of metrics because we know not any one of those metrics can be looked at in isolation. We are seeing our day over day new case counts being about stable. We're somewhere between 400 to 600 new cases a day, which is still a number of new cases a day. I think North Carolina has been in a different place than a number of other states that saw an initial surge or had a peak and are now seeing declines and are having still the same number of day over day new cases that North Carolina does, but for them it's a decrease. And for us, it's more of a leveling or a stability in the numbers. So I think it does put North Carolina in a slightly different place, which is why we were very transparent from the beginning. Now, more than 3 weeks ago, put out the metrics that we were going to be using to look at. We don't want to use just new lab cases day over day. We want to look at our surveillance data. We also want to know what is the percent positive of all the tests that we're doing. What is the percent of them that are positive? And we've been trending downwards and are somewhere near 6%, 5% of the tests we do overall are positive. That's very strong. And we continue to have a lot of capacity in our medical system. And overall, our hospitalizations have remained stable, fluctuating, 50, 100, but largely very stable. So those are the things that we look at. We are in communication with our federal partners on a variety of topics at the CDC, at the White House, at FEMA, and others. And we continue to talk about how does North Carolina compare to something like a New York, given that we had very different experiences in the March and April timeframe, and how should we look at our cases? But I think it also rightly points out we need to be measured and cautious as we go. We have virus here. We continue to see a lot of new cases day over day. And so we need to make sure that we are doing the 3 W's, wearing a face cloth, washing hands, waiting 6 feet apart. And we also wanted to take that measured approach to reopening. We are different, I think, than other states. And so we wanted to take that measured approach to reopening, starting with some of the lower risk activities. Because we never saw that surge, we don't know exactly how this virus is going to be here in North Carolina. So we need to take that measured approach as we go. And I think right now I see things holding stable. I know we'll do a full update of numbers for folks tomorrow when the governor returns with us. But we feel overall we're about stable or are seeing a sustained leveling on a large number of our trends and metrics. Thank you.
Jonas Pope, News and Observer.
Hey, this is Jonas Pope with the NNO. I have a couple of questions. First, some counties are claiming that they can't release the zip code data or the number of people infected at particular nursing homes before the state does. Is that true? And if so, why is that? And then my second question about Senate Leader Phil Berger put out a release saying that barbers and salons should reopen, and I would like to get your take on that. Thank you.
So let me do the counties releasing zip code data and other, I think you said congregate living or nursing home data. So the way we should know how the sequence of data collection goes. It's unfortunately a very manual process, right? Folks are at a nursing home, an outbreak, which is 2 or more cases, might happen. They are working hard, obviously, to contain that infection, do a lot of testing. They often will bring in partners from their local public health departments to help with technical assistance and making sure they're doing the infection control or to help with testing. And so as that data moves along, right, we all are working hard to provide you with as much of a consistent but accurate picture of all of the data. And I think that's what we're talking about. We're trying to get out of this desynchronization of some of the counties reporting and then we report, and just wanting to have one picture that everyone is able to have in terms of accurate numbers. And so it's not a perfect system because of the very, very manual way and a lot of the way this data gets collected. So I don't think it's anything more than us trying to get synchronized on giving everyone accurate data. We have that data down to zip code level now. As you mentioned, we are providing congregate living setting information. So we're providing a ton of information on our dashboard, and we again are trying to do our best to stay synchronized across all of the various folks who report into us with all of that data. On your second question related to Senator Berger, yes, someone flagged for me just before that he was asking about barber shops and salons. Totally understand that has been a question that we have been hearing. As we've been talking about, as we wanted to move through the phases here in a measured way. We started in phase 1 with activities that were lower risk by nature. Things that were either outdoors or if you went indoors were ones where you could circulate and walk around and not be stationary. Because we know this virus is transmitted more when someone is in close proximity over a longer period of time. And by nature of a salon and a barbershop, obviously that is you are sitting down for a longer period of time and folks are close together because you're working on someone's hair. Now, the issue is we want to have those activities return. And in phase 2, we contemplate that returning of those activities. The issue is about risk, right? Is we wanted folks to first start with some of the lower risk activities, and then we would move forward to some of these higher risk activities. It was hard to say, go forward with a barber shop or a salon, but not a restaurant. Those are, both sit down indoor activities. And we felt like going to all of those right at first might be too much for North Carolina. Again, I think going back to Brett's earlier question is that we still see a lot of virus here. And we want to be sure that we're not going to see a surge of cases. And we've been very successful preventing that for our state, and we want to keep doing that. And so that's why starting with the low risk activities was really our focus. And we are now less than 2 weeks away from thinking about a move to phase 2, where we contemplate opening the salons and the barbershops. So hold on there. I know everyone wants a haircut, including me, but hold on a bit longer as we watch our trends. Please keep doing the 3 W's. I do think that we will get there when we pull together as a state. We are in this together, right? All of our actions influence everything that's going on. And I think if we can pull together as a state, that we'll be back getting haircuts and at our favorite restaurant, but in a different way. We'll have to protect ourselves in different ways than we have before, but we will get back there. All right, thank you. Next question.
India Jones, Spectrum News.
Good afternoon. I have 2 questions. So the first, I did an interview with an environmental health supervisor for a county here in North Carolina. When asked how restaurant inspections are being conducted, I was told that those inspections are between yearly and quarterly in their schedule. So my first question is, who holds restaurants accountable for following the CDC's recommendations if they do not have a scheduled inspection? And my second question is, more and more people are getting antibody testing. What does the results tell us, and what do they not tell us?
Thanks so much. Good questions. On your first, related to who is the ones that come in and regulate the restaurants, you're exactly right. It is our local health departments that have environmental health supervisors. We obviously establish some of the policy and the procedures and the timing at the state level. We have folks at the state division of public health who help make sure all of that work is overseen, but it is the folks in the local areas that oversee those. And you're right, they're usually timed inspections over a period of time. And so, like anything, there's always regulations that are there, and then the inspections and the oversight are periodic. And it will remain that way in these cases as well. So, right, a lot of this is folks needing to take a really good look at the guidance, understand how to implement it. And I know that they want to protect their own employees. They want to have a safe environment for their consumers. So we know the vast majority are already thinking about how they can do all of these things. And then our job as regulators, either at the state or the local level, is to come in and be sure. But we're not there every day, every hour. That's not possible. It never is as we regulate restaurants day to day. But regulations do exist, and the expectations, they're following them, and that procedure will continue as we move through these. And again, I know in talking to the restaurant associations and restaurant owners, they are being very thoughtful about how to create environments that can be safe, and we're using this time while we're in phase 1 to get ready for what phase 2 will look like. It won't be the same. There will be, additional requirements and recommendations there. So, and they recognize that, and I think many are preparing for that. On your second question relating to antibody testing, great question. There is more antibody testing available throughout the state. We're still at the beginning of knowing what does antibody testing really, how does that really help us here, particularly how long do antibodies last? So if you find that you have antibodies, it means that you were exposed to COVID-19 in the past. Doesn't mean you don't have it right now. It means you were exposed to it in the past. What we don't know yet is how long does that immunity last? Obviously, with something so new like COVID-19, that's really hard to know. We have to see more time go by. So I think that there is still definitely scientific work that needs to be done related to antibodies to know exactly what do they mean, what level of antibodies, how long do we see them, do we need repeat antibody testing? I think all those things are unclear. I think they're a good tool to help us get a snapshot, or what's called a prevalence rate of COVID-19 here in North Carolina. Can potentially help us say, well, how many people have really been exposed? Because we know our lab confirmed cases are not the total universe of everyone who's had COVID-19. That's just who's been tested. So the antibody test can give us a sense of how many people have been exposed and have had COVID-19. What we're seeing from some of the early results is a very, very few people in North Carolina, around 2% potentially. Again, those are really early results, so I don't want to emphasize those, but really early results showing that not a lot of prevalence here, which is not surprising. We did not have a peak or a spike of cases. So it's not surprising that we had a low prevalence rate that's coming back through these antibody tests. So stay tuned for a lot more research in the scientific community that I know is ongoing on antibody testing. Thank you.
Andrea Blanford, ABC 11.
Hi, Dr. Cohen. It's Andrea Blanford with ABC 11. South Carolina, which has about half the amount of positive cases of here in North Carolina, they just announced it has 400 contact tracers on its staff and has retained another 1,400. Are we still sitting at 250 contact tracers today, and how many have been hired since launching the collaborative, and when will they be deployed? Thank you.
Thanks, Andrea, for that question. And I'm going to look at they're ramping up to 1,400. So where we are, we were already in a good place as a state because we have folks in our local health department that were doing this work already. We had something like 250. We are gearing up to have 250 more very, very shortly, and then up to probably another 250 after that. What's been fantastic is that we are looking to layer on not just those that we are going to hire as new tracers, but also looking how we can use our local health department and their teams that are already existing to do tracing efforts. And there are other volunteers that have come forward since we've been talking so much about contact tracing. So now we're figuring out how do we deploy sort of a volunteer corps with our trained and hired corps. So those are the things that we're sort of working through now so that we feel like we have as many hands on deck that we need in North Carolina as we move forward. So that hiring is going on. The training is beginning, and we are partnering with an organization called Partners in Health. They've done they are standing up the contact tracing work in a number of states, and we are able to sort of glean from their expertise on both the approach and the training, and how do we actually step through this. We're learning a lot as we go, and one of the things that we're learning is that as people get a call from a contact tracer, I think we all do this, right? We see a number on our phone that we don't recognize, and we don't pick that up, right? We screen any numbers we don't know. However, that could be a phone call coming from a contact tracer wanting to get in touch with you about potentially being a contact. So we're going to have to work in a number of ways. I think having the number of people on board is really important. Obviously, you just want the manpower and the people power to move forward. But then there's these other little things that we're learning as we're doing more of this contact tracing. So how do we make sure we can actually reach people? And so we're going to be working on our communication efforts so people understand that they might be getting a call and what would that mean for them, and how to step through following the guidance from those contact tracers as we go. So stay tuned, and we'll need your help in the media side, getting out that good information to folks as we step through this. Thanks for that.
Elizabeth Ann Brown, Asheville Citizen-Times.
Hello, Dr. Cohen. This is Elizabeth Ann from the Asheville Citizen-Times newspaper. My question is regarding kind of the nature of unemployment and health concerns as we move forward, as more businesses are allowed to operate in phase one and then later in phase two. How will people who have concerns about their ongoing health and safety be regarded in terms of unemployment? That is, I'm thinking about those employers who think it wouldn't be safe for their business to operate, though they legally could, and then employees through whatever health concerns they may have that aren't confident about returning to work, though their job is still there for them. How will that be considered?
Thanks, Elizabeth Ann, for that. I think you are highlighting an important issue here where this is not just about is the business open or not. There are a lot of factors that go into, I imagine, any business decision about when to reopen, how to reopen, how to bring folks back. There may be businesses that know many of their employees are at higher risk. They may be older. They might have chronic diseases. They maybe are fighting cancer. So there are a lot of considerations that go into this, and there's no one size fits all. We have to set a floor for the state to say, look, based on the trends, we don't think that folks should do these X, Y, and Z things, but here's the floor. And then folks need to, whether you're a business owner or an individual citizen, you're needing to think about your own individual risk. And so there are a lot of considerations for businesses as they think about reopening. What I would say about our guidance to those employers is that we are saying anyone who is at higher risk, we would ask those businesses to work with those employees to put them in lower risk settings. So if you can imagine a bakery, for example, if you're maybe not the person who is, at the cashier, but maybe working, answering the phone or in the back doing the baking, and can we do accommodations that allow certain workers to be in less risk settings? Sometimes that's not possible. And then we have to think about, well, what other accommodations can they make, whether it's different kinds of face covering or other modifications to their job. I think these are really hard issues that we want to just give the best guidance we can from the public health perspective. And then folks are going to have to use their judgment based on what's going on in their community, their own individual employees, and the nature of their business to sort of make the decisions going forward. We're just hoping we can give as much guidance as we can. And again, the science here continues to evolve, and we learn new things. I'd say one of the things we have learned since the beginning of the pandemic is how much spread of this virus happens when you don't even know you have it. I think that has been a big learning for me personally, but also for the scientific community. Unlike a flu, where there is a much shorter time window between when you are contagious and when you show symptoms, here there are folks who never know that they have COVID-19 and can be spreading the virus. And that is really of concern to me as I think about these kinds of decision-making activities that I know businesses and individuals and families are going through, which is, again, why we go back to the face covering. When there's a lot of spread of the virus, when people don't know that they have it, wearing a face covering can really help prevent the spread of the virus to other people. Thanks for that.
Our final question today will be from Ken Smith, WRAL.
Good afternoon, Dr. Cohen. Ken Smith from WRAL. Thanks for taking my call. Listen, as North Carolina is surrounded by states that are reopening, there's some concerns that we heard from on Capitol Hill yesterday from the folks like Dr. Fauci, just really concerned about states as we reopen. I know the governor is going to go through the numbers tomorrow, but is there any way that you can put the genie back in the bottle if these trends don't start going in the right direction, and what will that look like?
Ken, thanks for that question. And look, this has been such an unprecedented time for our state, our country, our world, that it's hard to predict if this would happen, what would we do then? What we will continue to say is that we'll look at the numbers and continue to try to make the best decision we can based on science and data. We acknowledge that there is more going on in our state than just COVID-19, and we have to think about both safety and protecting people's health as well as what is going on in terms of mental health, spiritual health, financial health. So we have to put those things together, and we do when we are considering these decisions. And we will continue to put that at the forefront of our thinking about the people that we serve here in North Carolina, and try to make the best decisions based on what the public health data and the science offers us, knowing that science also is changing as we go here. So I know that we are trying to strike the right balance of taking a measured and phased approach to reopening here as we go, and we will go through this, like as you mentioned, in more detail tomorrow. So stay tuned. I think no matter how fast and how slow, I think we are going to have a different way of moving through the world. And that's why I keep coming back to the 3 W's about wearing the face cloth, staying 6 feet apart, and washing your hands. I think that's going to be part of us moving through the world while the virus is with us here in North Carolina. So that's going to be the basis of recommendations, and then we'll try to make appropriate measured decisions going forward. And if we need to, we will walk back. We will walk back to stay at home if we need to protect public health and the people of North Carolina. So we appreciate all the questions. We'll be back with you tomorrow with some charts and graphs. So thank you so much. Have a good afternoon.